Hey guys, this is Tyler Andrews with Southern California EMS Training Institute. Today we're going to be going over how to spike an IV bag. An IV stands for intravenous. This is something that a paramedic does. He inserts a needle or catheter into a patient's vein, and then he can go ahead and give maybe medications or fluids or other treatment through that IV line. Now, a lot of times as an EMT, we need to spike the IV bag, and here's an example of an IV bag. And this is a bag of fluids that maybe that paramedic would administer through that IV. So we're gonna go ahead and get this IV set up for him. We're gonna prime the line, make sure that we have fluid in it, and hand it off to our paramedics so they can continue with their treatment. So we need a couple things as we're doing our how to set up an IV. Number one is we need our IV bag, which I just showed you. This is a 1 liter bag, and obviously we can see the drug here at 0.9% sodium chloride. So there are different ones, so we want to make sure that we grab the correct bag. Again, this is 0.9% sodium chloride. This is normal saline is what we also call it. And again, this is a 1 liter bag. Bags also come in 500 milliliters, 250 milliliters, maybe 100 milliliters, even 50 milliliters. It kind of just, the size of the bag depends on what your paramedic is specifically going to be using it for. Typically after trauma or aggressive fluid management, we give something like a liter bag, so we can go ahead and give that to our patient. We also have an IV administration set, all right, or a tubing, IV tubing, and we need to make sure that this is what we're going to spike our bag with, and we're going to prime it, make sure we have fluid in there, and we have it all set up. So stillness package ready to go, and obviously we need our BSI and our PPE on as we're doing any sort of patient care. So. A couple things. So when we're setting up our IV bag, one of the important thing is typically I like to hang it somewhere, right? If I have somewhere where I can hang the bag up high, so you know that fluid's going to run down. It is gravity fed, so we do need to make sure that it is up high. If you don't have anywhere to hang it, sometimes I'll do it on my shoulder and I can spike it if necessary. You can have a partner hold the bag up, you know, or sometimes you might have an IV pole or somewhere in your rig where you can hang the bag. I'm going to hang it up right up here for right now. I got my bag all ready to go. I should be right and dicing my medication. That should be the paramedic's job. And then I need to go ahead and open my IV administration set. So I'm going to go ahead and pull this out of this package. It should come just like this. I'm going to show you a couple key features about this IV administration set. So number one is at the very top of it, we have what we call the drip chamber. I'm going to go over this, but this is where we spike the bag, right? So this part right here gets inserted into the bag. And then as we fill this chamber, it should only be 50% full because we want to see drips going through this chamber so we know how much fluid we're giving over what amount of time. So it's really important, you guys, that we do fill up this chamber, and I'll show you guys how to do that. But more importantly, right, we only ever fill it up 50% full. Now we also have all of this tubing, and if we continue down the tubing, we'll actually see a roller clamp here. This roller clamp helps shut off our line. So if I go ahead and I clamp this thing down, I roll this little green wheel down, it clamps off the line so no fluid's going to get through. When you first open these packages, all right, this clamp is always open, so make sure you find this and go ahead and clamp it down, right, to make sure that any IV fluid is not spilling out on the floor of your ambulance or on your patient or anywhere in the back of the ambulance. Then we also have a couple of different ports. So you can see this one actually has 2 ports right in the middle of it. This port, this is known as a needleless port, which means a paramedic can hook up a syringe and give medications through this IV line into the patient's extremity. Again, that is a paramedic scope of practice, so we cannot administer medications through the IV port, but you know, we are getting the IV set up for the paramedic. At the very, very end, this is where the IV actually attaches to our IV administration set. So we would hook this up to our IV catheter, right? And you can see this actually comes with a little cap on it, which we want to leave in. We don't want to remove this cap. That should be the last thing the paramedic does as they go to actually attach it to the IV. We want to keep this sterile, right? Which means we don't want any bacteria or things going into our patient. So we're going to leave that cap on as long as possible. So now what I'm going to do, now that I've actually clamped down my roller clamp, I'm going to go ahead, I'm going to remove the sterile cap for my IV bag. All right, so now we can see we have this nice sharp, right, thing to go ahead and insert into our IV bag. We go ahead, I'm going to remove my my sterile port for my IV, and I'm gonna just insert this up into the bag, just twist it nice. It should go all the way up, and you can see there's 2 lines that actually should get nice and flush here. Now, if you can see, we have our IV drip chamber. This drip chamber, like I said, you squeeze it, and it should fill up with water. Right? And I just want it 50% full. That's all I want. Now, the most important thing when we're actually setting up an IV, right, is we should actually have all of this IV tubing, all right, should have 0 fluid in it. Sorry, it should have 0 air in it. We want it to have fluid. So right now I just have this one huge air bubble in this line, because if you remember, I've clamped down my IV. Now, if I were to go ahead and put this on the patient's arm, I would just inject a whole bunch of air into your patient, and that could actually kill your patient. So the most important step is to flush out this line, is to prime this line before we go ahead and we insert it on the patient's arm. So the way we do that is I'm going to go ahead, I straighten it out, I make sure I have somewhere to put my, my tubing. You guys can't see down here, but I'm just going to go ahead and point it right towards the trash. I'm going to roll up my clamp. Once I've had the fluid come all the way through, I just need enough to come out the end. I go back and I do a quick inspection, right, to make sure that I have no large air bubbles in here. So now that I can see I have no large air bubbles, I can go ahead and hand this off to my paramedic. Now, what you guys didn't see is I did pull off that sterile cap on the end of my IV, so that water could flow out the end. You don't need to pull it off. It should still be able to come out, but I feel like it just flows faster with that cap not on. Now, because this is not, right, we don't want to have this touch anything else because it's sterile right now. I'm not going to touch it with my hands. I'm not going to touch it with anything in the ambulance. I shouldn't set it down anywhere because that would make this not sterile. So now that I've finished this, I have this sterile end. I'm going to pass off to the paramedic. The paramedic will take it and attach it to the IV. So make sure at all possible time we do this as sterile as possible. That's why we need the gloves and everything else while we're doing this procedure. So this is how to set up an IV and how to spike an IV bag. And again, you guys, this is Southern California EMS Training Institute. So thank you guys very much.